Good afternoon, everyone, and we have a new face at the table again today for our briefing. So I'd like to welcome and introduce Paula Corcoran at our table today. And Paula is the Chief Executive Director of the Consumers Health Awareness Network of Newfoundland and Labrador, and some people would know that to be as CHANNAL. So it is fitting that Paula joins us today as we recognize, as we mentioned last week, this is Mental Health Week. And speaking openly about mental wellness is extremely important to all of us. So to me, as someone who has spent many of my working years in the community and dealing with many people who have had to deal with mental health, I recognize the importance of taking care of your mental health and your wellness. And we have spoken about this often, and we know that there are many people across the province that are facing a tough time. It's a challenging time. And even before the pandemic, but living with the pandemic on top of all these challenges in life, you can expectedly increase the level of stress and anxiety. So it's important to have people like Paula here at this table with us today as we begin Mental Health Week with who has a lived experience, but also can speak to some of the supports that are available. But before we get to Paula, I want to turn it over to Dr. Fitzgerald to provide us with today's update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media advisory yesterday, we have no new positive cases. The total number of cases in our province remains at 259. By region, we have 241 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 53% of cases are female and 47% are male. And by age, we have 22 people under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 4 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 233 people have recovered, and in total we have tested 8,935 people. No new cases over the past weekend, and again today, is certainly reassuring and a true testament with our concerted efforts that we can reduce the spread of COVID-19 in our province. We are not out of the woods yet, but following public health guidance will most certainly help us get there. Once we begin lifting some of the public health measures in the coming days, the discipline we have fine-tuned over the last number of weeks will be more important than ever to help keep COVID-19 at bay in our province. This means, as difficult as it is, we must continue to keep our physical distance from others outside of our double bubble, only to go out once a week for necessities, stay home when we feel unwell, practice proper cough and sneeze etiquette, and wash our hands frequently and well. These proven measures are our best safeguard against COVID-19. I would like to reiterate today the importance of choosing our expanded bubbles wisely. We know that individuals over the age of 60, those with compromised immune systems, and people with underlying medical conditions are at an increased risk of more severe disease and outcomes. Consider not doubling your bubble if you fall into one of these categories to reduce your risk of possible exposure to COVID-19. If you are at higher risk of complications due to COVID-19 and choose to expand your household bubble, you should be cautious about your choice. Have a conversation with the residents of that household to make sure they understand the potential risk to you and your health. And we understand that many of us are eager to see and reconnect with family members, particularly parents and grandparents. And if you do pair up with a household in which a vulnerable person lives, please take extra precautions. Screen for COVID-19 symptoms before entering their household. Clean your hands upon arrival and often while there. Consider wearing non-medical or cloth masks to prevent your respiratory droplets from landing on and contaminating surfaces. And stay away completely if you feel unwell. We must do our part and take the appropriate actions to keep our loved ones safe. As the weather warms and most of the snow has now cleared, I also encourage people who are not self-isolating to get outside as much as possible and enjoy some physical activity in spring air. Please be mindful, though, about keeping a safe physical distance of at least 2 arm's lengths from others outside of your bubble at all times. As this marks Mental Health Week in Canada, I would like to acknowledge the importance of mental well-being during what has most certainly been a challenging time for many of us. If COVID-19 has taught us anything, it is that we have our own vulnerabilities, and staying connected while having to stay physically apart has never been so important. It is unfortunate in this day and age that judgment and stigma are still active members of our society that often keep people, whether a person with mental health issues or a person with COVID-19, from getting real about how they feel. Speaking up is not a sign of weakness and despair, but of strength and resolution. And please know we are all in this together. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory. The total number of cases in the province remains at 259, with 241 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenfell Health. We continue to move in the right direction, and I thank you again for your persistent dedication and commitment to protecting your loved ones, yourselves, and the most vulnerable members of our society. The future of COVID-19 in our province depends on the actions and choices of each of us. As we embark on a new week, let us keep our eye on the target, our spirits high, and our momentum strong. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. These are great remarks, both from the mental health perspective, but also the fact that there's no new positive cases over the weekend and no new positive cases in your update today. It is welcoming news for our province, as you said, so let's make sure that we maintain this over the next days and weeks ahead. As you work day in and day out to guide you through this pandemic, and as we gear ourselves towards Alert 4 in our plan, it's critical that you continue to follow the health guidelines that have been put in place by our Chief Medical Officer. The thing is, the only way that we're going to get through this is, as you know, it's through working together and with your cooperation. Last week, Dr. Fitzgerald allowed us to expand the bubble, and the message underlining all of this, of course, is safety is top of mind. What we have to remember that if we do not practice the safety measures and the guidelines that we put in place, is there is a real possibility of either going back or staying at alert level 5. So as you proceed, please be responsible and do it with caution. We are close to hitting the 2-month mark now since the pandemic started to wreak havoc in our country and in our province. And for many of you, I know it's been challenging. It's been tough. It's been tough on you, tough on your families. It can be lonely. It can be lonely for many of you at different times and for different reasons. The thing is that throughout this, that everyone has a story. Everyone's story and life path can be very different, and that's okay. So as we live through the pandemic together, we have to remember to take care of ourselves and our mental health. This year's theme of Mental Health Week is quite fitting: social connection. It aligns perfectly with our messaging over the last few months, and although that we've had to maintain physical distancing, it doesn't mean that we cannot be social with family, friends, and neighbors. We just have to be more creative, or just bring back and go back to some of the basics of just the simplicity of a phone call. It's surprising how positive it is to hear someone's familiar voice on the other end of the phone, as opposed to a text or a Facebook Messenger message that are sent quite often to us. Just that phone call and that familiar voice can make a big difference. For some, it can be even life-changing. This week, it is a reminder of the importance of having some real conversations with family and friends and some of the most vulnerable in our society. It's the simple gestures in that sometimes we take for granted that has the greatest impact. This morning, I signed a virtual proclamation to officially kick off Mental Health Week in Newfoundland and Labrador. Recognizing that mental health goes beyond the week, we must focus every day. So even though this is a week that we put some focus on, it is day in, day out, week after week, month after month, that we must continue to focus on the importance of mental health. It's also a reminder that across the country that many provinces and indeed other jurisdictions outside of Canada are looking at the work that's been done in Newfoundland and Labrador. And I was proud with the Minister and many other community groups to announce a few years ago our plan towards recovery. I'm also proud that the plans are progressing to replace the much outdated Waterford Hospital, and I look forward, like many of you do, to see shovels in the ground and get that building replaced. Now this afternoon I am pleased to have Paula Corcoran sitting next to me at this table. As we said earlier, that Paula is the Provincial Executive Director of CHANNAL. They are a peer-led mental health and addictions organization in our province. And throughout her role, Paula has added the combination of her personal experiences of living with mental illness. Paula also has the challenges and successes of leading this organization and being part of a system that is transforming. Now, I've known Paula for quite some time, and I think quite highly of her work and the work that she's been doing within her community. We've worked with Paula as a government on several times for her knowledge and her experience. As her example, Paula chaired the Recovery Council under the Mental Health and Addictions Action Plan. So with further ado, I now pass it over to Paula for further comments.
Thank you, Premier. And first and foremost, I'd like to extend a sincere thank you to yourself for inviting me here today to sit and speak with you folks. As the Premier has mentioned, today starts the beginning of Mental Health Week, and coincidentally enough, it's also Health and Safety Week. And so these weeks coming together today during this unprecedented time is certainly a time that we can talk about these important things. As the Premier has mentioned, I am the Executive Director of CHANNAL, and our organization works very strongly in engaging individuals who have lived experience. And so one of the unique pieces of our organization is that all of the staff, all 26 of our provincial staff, live with a diagnosed mental illness or addictions issue. And so the service that we provide is extremely unique in that we are able to identify with individuals who contact us through our services. As the Premier has indicated, talking about mental health certainly is not something that we limit to just 1 week of the year. It's something that we all talk about and we all need to talk about throughout any given time and any given day. The current situation that we're all living through, this pandemic, this world crisis really has certainly highlighted the need for all of us, not just individuals who identify with living with mental health conditions, but for all of us to recognize that stress and change are highly impactful to our health and to our mental health, and that all of us are vulnerable at any given time. As Dr. Fitzgerald mentioned, it's a struggle sometimes for people to face stigma and come forward and talk about their mental health. In fact, research shows that individuals, there's about 68% of us will not seek help for our mental health because of stigma. And so looking at the times in that we're living right now, I would implore all of us to acknowledge that we too have mental health and have mental health challenges within this given time. Oftentimes we hear from people that have an explanation of, I'm not sick enough, this is not bad enough. But again, I implore you to look at ourselves and recognize the importance of early intervention. And as the Premier has indicated, picking up the telephone and having a conversation with a loved one could very well be the thing that prevents you yourself from deteriorating with your mental health. From a lived experience, from a personal experience, I live with a mental illness. I have been diagnosed for over 15 years now. And while there have been some comic relief saying that individuals like myself have been preparing for this type of an experience all of our lives, it certainly is not something that we need to make light of. And it's not something that any one of us within our province right now is taking lightly. We have all had very different experiences to this current crisis. And if I were to leave you with something, I really want to acknowledge that right now we are all having a very, very normal reaction to a very abnormal event. To my knowledge, none of us have lived through a pandemic, certainly not of this magnitude. And so how we are responding, be that with pleasure because we have some time away from work and time to spend with our children at home, if it's frustration for being at home with partners and children that we're not usually experiencing, if it's just a sense of disbelief of how is this really happening, all of those responses are normal responses to something that we don't have a handbook for. We do not have a guideline on how do we respond emotionally to a pandemic. I myself have been very directly touched with this. I have been a part of a cluster and have been at high risk of contracting the disease and the virus and have had to be tested. And I can assure you that the amount of stress and anxiety and just the decline of my own personal mental health and the mental health of my family is significant. I have a vulnerable member of my family who I have had zero contact with simply because this is a very vulnerable time for my family. My children are experiencing the fact that mom is at home. The stress levels are very high. So again, recognizing that while I live with a mental illness, this is not a condition, this is not a time and space that is restricted to just those of us who have mental health and addictions issues. At CHANNAL, we have a multitude of services. The Provincial Warm Line has been expanded over the recent months from support from our provincial government, so that while we have always been provincial, we now are expanded to be able to screen more calls than we have ever screened before. And what we are seeing as an indication of the need in our community is that we're getting less calls from individuals identifying with having mental health conditions and more calls from the general public dealing with the real stresses that we are living through right now. Again, as we work into Mental Health Week, this week we are doing some activities around our organization and throughout the community. Of course, we've had to be extremely creative and come up with some virtual solutions. But again, we invite you to think about your mental health personally, but also the health of your family, and start to see that we can get through this, we will get through this, and as we've heard multiple times, we are in this together. You are not alone, and please feel free to reach out.
Well, thank you, Paula, for sharing those words, and thank you for your openness and sharing of your time and your experience. You've mentioned the fact that it's a reaction to living in what is an abnormal event for us in our province, and indeed that is so true. And Dr. Fitzgerald mentioned in her earlier comments about, this is not a sign of weakness, and if you talked about the stress and change and that the stigma that prevents many people from reaching out and coming forward, we all know that the early interventions can be so important. So we thank you, and I know there are thousands of residents that are tuning into this afternoon's address and for this daily update, and we want to thank you for joining us today. I also want to take this moment to personally say that I hope you are doing well, and I want you to know that we are doing whatever we can to support you through this health crisis. So for those of you that are watching, you feel stressed and anxious, remember there are resources that Paula has just mentioned there for you. Bridge the Gap is a website that we've been promoting, and we mentioned many times throughout these updates, and that's Bridge the Gap with GAPP. And you will find resources for both adults and youth within Newfoundland and Labrador, those that are looking for support on mental wellness. Paula mentioned the warm line that's available if you need to talk to someone with lived experience. That number is 855-753-2560. And for those of you that might unfortunately find yourself in a crisis situation, you can call the Mental Health Crisis Line, and that number is 1-888-8737-4668. And as Paula's t-shirt says, that you are not alone, and indeed we're here for you. And we've been working hard on making additional supports available to you and help in other areas of life that can add additional stress and anxiety. One of these areas is around food security, which we hear quite often about through our daily updates. A few weeks ago, if you remember, that as a provincial government, we supported the Food First program by $560,000, and funding was put in place to support community food programs throughout Newfoundland and Labrador so that they may be able to continue the important services during this public health emergency. So today I'm also pleased to announce that the residents of the province that you can now call the provincial government's 811 health line. You can call this service to access the basic information about food programs in your communities. This could include something as a referral to the food bank and to meal programs. And as you know, on Friday of last week, I launched a dedicated cellular text line, and it was a dedicated line for video relay service technology. And this was put in place for the people who are deaf and hard of hearing in our communities, or for those of you that have communication disabilities. Our 811 health line operators can also refer callers who require the additional support, such as help with, could be something as an online grocery order, a meal delivery service, to the Newfoundland and Labrador Community Food Helpline. So these are all services that we've been enhancing and putting in place, and the 811 number, of course, is a new initiative in partnership with the provincial government, with Food First NL, the Jimmy Pratt Foundation, Seniors NL, who do a remarkable job, and Newfoundland and Labrador Association for the Deaf. So I thank all of those people who've been working to support our community groups. Again, I would say that all this information can be found on the COVID-19 website. And once again, thank you in helping us with food security in our province. And also, once again, for Paula for joining us today and supporting mental wellness in our province. We all know that it is by working together that we will see the positive change. So let's not forget that the small gestures, a smile or a phone call, can truly brighten what could otherwise be a dark day for someone else. So we need each other right now, and we need it more than ever to continue to work together. So reach out, say hello to somebody. Let's keep that momentum going. Let's be kind to each other as we work to stop the spread of COVID-19. So stay safe, everyone. And I will now pass it over to Minister Haggie. And I will say, as we've worked together now for about 5 years, he's been a true champion and advocate for mental health in our province. And I now turn it over to the Minister for his comments.
Thank you very much, Premier. I think, again, referencing Dr. Fitzgerald's comments, 0 cases is a great way to start another week. It is Mental Health Awareness Week. That comes around once a year. And this year's hashtag is Get Real. I first met Paula some years ago when we were doing some work with CHANNAL and the Warm Line to appreciate its metrics and its value, and to see how we could work together to make it more widely available. I think that's been a very successful partnership. Her lived experience and her eloquence made her an obvious choice to chair of our Recovery Council, which, for those who are not familiar, is a group of people whose sole criteria really for consideration is lived experience or being part of a family with lived experience. And that has been invaluable to me as Minister to help not only set up towards recovery, but also to guide it through its implementation. And it's been great to see the benefits. And I think, quite frankly, without the groundwork that had been made through that process, we as a province would be in a much less better place to be prepared for COVID-19 in many respects. We've all seen over the last 6 to 7 weeks how the stress of completely changing your way of life in many respects and the way we interact has built up on people. We've seen it taken out in social media. We've seen it expressed in various ways, from denial and those kind of things, all the way to some of the things that Newfoundlanders and Labradorians are more famous for, which is looking after each other and reaching out to each other. For that stress, we have had a framework where we could look at mental wellness. Premier's reference, Bridge the Gap. We have 811. We had Doorways regarded as an essential service, and that's kept going throughout the pandemic. But all of us, each of us, have been affected by the stresses of this time. And as Paula said, very few of us have had experience of a global pandemic, if any. We have seen over the years the stigma and the effect that stigma has had on people with mental health or addictions under less trying circumstances. That stigma has led to silence, and that silence has literally led to death. It's interesting when you compare physical and mental illnesses and the way people talk about them. You don't really hear people minimizing their physical illnesses in quite the same way. I can't remember the last time anyone talked to me about having just had a touch of cancer, for example. And yet there is always this desire and this need internally to minimize your own trials and tribulations and to even not seek help because of it. I think, in a sense, we're almost moving now from a discussion about stigma to one of perhaps discrimination. And certainly you've seen that on the world stage. And New Zealand, who we have a good partnership with in terms of our mental health approaches, has moved in that direction. So, again, reach out. Older folks sometimes just quite comfortable with the telephone, although we use this kind of higher tech approach. We have done well. We've done well through the pandemic. And by the measures that Dr. Fitzgerald has put in place as guidance with prompt action, we have flattened the curve of the first wave for sure. Getting out of this now, however, is going to require slow reaction. Can't be done quickly. And the measures that we've talked about and the double bubble, for example, of last week will lead into hopefully a reduction of restrictions as we move into alert level 4. And that's a gradual opening of a door. And I would really encourage everyone, as much as they are tempted, not to rush through that door and push it wide open in the first few weeks. It is not far, and it will not take much for this virus to take hold and for clusters to form again. And we, through hard work and a little good fortune, have been able to avoid a situation where our healthcare system has been overwhelmed. We have to maintain that level of effort, maintain that level of vigilance, because otherwise that risk still exists. We're not out of the woods yet. So you've heard Dr. Fitzgerald, stay home if you're unwell, don't go out if you don't need to, pick who you expand your bubble with and do it in a sensible, thoughtful fashion. Stay in your bubble, big as it may be now, or bigger as it may be now. Don't burst anybody else's. And I think the important thing at the moment is, as Dr. Fitzgerald said, hold fast. We need to hold the line. This is a long road we've got to walk between now and the fall. So with that, Premier, I would close my comments and hand the event back to yourself.
Well, thank you, Minister Haggie, and you're right. Your words of caution is certainly something that I think that is, people in Newfoundland and Labrador have heard so many times. And we're reminded, if you look at, just 18 days ago, we've now see across the country, even though in Newfoundland and Labrador we've been doing very good, following the guidelines, some 259 cases. But if you look across the country, there's some 60,000, Canadians that have tested positive, and that has doubled in 18 days. So you tell, and your words of caution today are certainly words of wisdom to all of us here in Newfoundland and Labrador, and we appreciate it. I now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues, and all other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. I will call each reporter by name to ask questions. Please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Ben Murphy of BOCM News. Please go ahead.
Thank you. We saw and heard about a lot of cases over the weekend about people getting together beyond the intended double bubble. How big of a concern is for this, and if it continues to get worse, is there any chance we could see this reversed?
So we certainly,
Ben. Oh, sorry,
no,
Dr.
that's
Fitzgerald.
fine. Go ahead.
Certainly, Ben, it is a concern, and fine weather combined with a feeling that things are turning the corner is a very dangerous combination. But really and honestly, we'll pay the price, and you'll only know how well you did in 2 weeks' time. So the facts of the case are We are nowhere near out of the woods yet. We may be in the position to make a first step in that direction. But just as easily as we had to lock things down back in mid-March, early March, we may find ourselves in that situation again. We just don't know, and I would urge everyone to be cautious.
And we heard last week that more clarification around the travel ban that came into effect today would be coming. Those who are from here and lived here for years and years, who may now live and work away, is it a hard no for these people who may be returning this summer, who may have summer homes they've had here for decades?
So the intention of this order is to control the importation of cases from elsewhere in the country and in the world. And as we know, there are areas of the country that have a lot more cases than we do. So unless there are extenuating circumstances that need to be considered, then yes, it will be a no.
So Ben, if you listen to the earlier comments, I think when you look at what's happening outside of Newfoundland and Labrador, and we really thank the people of the province for the work that they've been doing in complying with the guidelines, but we must not forget that there's been some 60,000, nearly 60,000 positive cases across the country, and many people would be traveling in through another province to get into Newfoundland and Labrador. And that number is doubled. That 60,000 number, that is doubled in the last 18 days. So it just really speaks and highlights the fact that this virus is still, in the country. It's still in other provinces. And what we are doing with the work of the chief medical officers to make sure and do whatever we can to prevent it from getting inside of Newfoundland and Labrador.
And Dr. Fitzgerald, what is the rationale for exempting construction workers coming from out of province to self-isolate when they're here working next to our local workers? It just seems like it kind of contradicts some other orders.
So the exemption applies to people who are deemed critical for the infrastructure work. So that was the intention of that exemption order.
Our next questions are from Jody Cook of NTV News. Please go ahead.
Hello?
Jody?
Go ahead.
Hi there. Okay, so my first question is in relation to long-term care facilities. We understand that Pleasant View Towers has been identified as an appropriate unit to have a COVID-19 exclusive unit for those residents who might test positive in other long-term care facilities within the Eastern Health jurisdiction. Can you offer some clarity on that?
From the point of view of Eastern Health, it was felt appropriate to designate an area in a facility. Pleasant View Towers is the most up-to-date. It has a significant proportion, if not almost exclusively in some areas, single-room occupancy. And it was felt that this would be logistically the wisest. It's also a little bit more centrally placed than some of Eastern Health's other facilities. So there would be multiple advantages to doing that.
Thank you. Last week, we understand, going into the weekend, that there was a letter sent to the Premier from the Canadian Camping and RV Council, as well as from the Association of Atlantic RV Parks and Campgrounds, ultimately looking for a reversal on the alert phases and how it would work for people at both campgrounds, be it private, and even some tent and cabin camping sites. Have you reviewed some of their concerns where they're asking for changes to recommendations right now and indications that they feel this could be done better?
So, when I look at, I get quite a few letters that would come in, by various associations and either industry groups or, advocacy groups that would come across our desks, and they would ask questions about, the recent plan that was put out last week by the chief medical officer. Of course, as politicians, what we've been able to do, given the fact that we're still under a public health state of emergency, is take the sage advice from our chief medical officer and the group that she has working with her. And so if it's alert 4, 3, 2, we get people that are asking questions about that. And we put in place a business guidance group now that would be able to support those industry groups. If they have questions, they can go there. They can work with they can work with the alert system, and is there they will get the information. But the science and evidence based on the decision by the chief medical officer rests solely with Dr. Fitzgerald and her team.
And finally, we've seen that going into this weekend, Alberta has rolled out their COVID tracking device. Well, I shouldn't call it a device, it's called an app, AB Trace Together. We know that it's had a significant uptick. They're the first in North America, from what I understand. Are you watching the rollout of that, the efficacy of it, the way they're using open source code, and any implications on how that's working and how you could see one working in this province?
Well, we certainly...
Short answer to that question is yes. There are groups across the country who have got products, as we say, at various stages. We have some skills within the province in terms of what data sources could be used to do that in a way that respects personal autonomy and privacy. Again, the evidence around the use of technology, the evidence around some of the decisions that we might make around testing, for example, you've seen how rapidly that's changed in the last couple of weeks, if not the last couple of months. So any experience, any information we can glean from another jurisdiction that would help make us make better decisions, then we're looking at.
Our next questions are from Marie Isabelle Rochon of Radio Canada. Please go ahead.
Hi. When asked yesterday if he was in favor or against tracing apps, Justin Trudeau said that he hasn't yet seen a contact tracing app that effectively balances privacy and public health needs. How are you making sure that the app that you're developing will protect people's privacy?
By listening to people with an interest in privacy, such as our privacy commissioner, who's actively involved with our group. The facts of the case are that, as Prime Minister points out, he hasn't seen one. Maybe it'll come first from Newfoundland and Labrador.
Thank you. And also wondering, passenger and transport truck traffic on Marin Atlantic ferries were down 72% and 31% respectively last month. Are you worried about what will happen if the federal government doesn't increase Marine Atlantic subsidies?
What was the last part of your question? Doesn't increase Marine Atlantic's what?
I was wondering if you are worried about what will happen if the federal government doesn't increase Marine Atlantic subsidies.
Yeah, so that's not a concern right now. We know the responsibility of the federal government. They know their responsibility in providing this service for Newfoundlanders and Labradorians, and we've been working closely with them, tracking the amount of travel and travelers that would be on that marine traffic, that would be on the crossing. So right now there's no concern that the federal government would back away from the support or reduce the subsidy as it would be required for Marine Atlantic. When you look at the way the federal government has stepped up to support businesses right across the country, there's no reason at all to believe that they would not be there to support Marine Atlantic if indeed more subsidies are required to put in place what is a constitutional requirement by the federal government.
So there's no worry about a price increase?
I have not been worried about this. This is not a conversation that I've had yet. But if indeed, Marine Atlantic, we'll work with them very closely as we would as a government. That is not a conversation or anything that they brought to me right now or to any of my cabinet colleagues. So if indeed there is an issue, I'm sure there will be discussions with Marine Atlantic, and is one that I would never back away of having a forceful conversation with the federal government on this issue. It's a constitutional responsibility of the federal government.
Thank you.
Our next questions are from Heather Gillis of CBC News. Please go ahead.
Travel measures coming into effect today, obviously affecting tourists and people who have summer homes here. Is it legal to enforce this when you take into consideration Section 6 of the Charter of Rights and Freedoms, which ensures mobility rights for Canadians? And have you consulted the Department of Justice on the restrictions?
I don't know if Dr. Fitzgerald wants to answer because I can't actually see her face on this link. She's completely in the dark, so I don't want to cut her off again. The short answer to that is yes, we have. If you look at, I think it's Section 13 of the Public Health and Health Promotion Act, it actually specifically references the need to keep the Charter in mind when making any of these decisions. We feel, given the recommendations from the international as well as the Canadian communities, this is entirely consistent with public health imperatives. And indeed, we would be probably the third Canadian jurisdiction to do this, following New Brunswick and PEI, who've also been very successful in keeping their curve flat, and also the province of Quebec.
Thank you. Do we have a number on the number of exemptions people have applied for?
I don't have an exact number of applications for exemption at this point. There were quite a large number that have come through over the weekend, and we do have a team that are combing through each and every one of them to determine if they would qualify for an exemption.
And when it comes to rural areas of the province, of course, residents of summer homes there and people who split their time between this province and another province, is there any worry about the economics of that with, people who have summer homes paying taxes sometimes in certain areas of the province with respect to property taxes and, spending a lot of money in the local economy?
It's always a concern when you think about the impact, the economic impact of what this pandemic is having on our province. But first and foremost, we put safety first. Safety and health of Newfoundlanders and Labradorians has to be a priority. We've all learned from the experience of what it can, if we get a cluster or a flare-up, and we all know when we look at what's happening across other parts of the world, that this could happen again in Newfoundland and Labrador. So we put safety first, we put our public health measures first, and as we start to relax measures and bring the economy back in line based on those measures, well then that we'll bring back the economic benefits. We also know that if we don't get it right, if indeed we had to have a major flare-up, that could have a more significant and more profound impact on our economy. So in some ways, doing it a little more cautiously can actually reduce the larger impact that we could have on our economy. So it's how you find that balance, but right now the priority is and the focus is on public health safety.
Thank you.
Our next questions are from Holly Mackenzie-Suter of the Canadian Press. Please go ahead.
The Premier, just wondering if you can give us any more information on the kind of legislation and what's expected tomorrow for the House of Assembly session.
Yeah, there's a number of pieces of legislation that they're working their way through for the order paper tomorrow. I know our House Leader, Minister Cody, has been working closely with other House leaders, and the order paper will be available tomorrow. There's a number of pieces of legislation that will be there. Some of that has been to deal with policy, and some of that has been to actually get pieces of legislation to conform with some of the issues around this pandemic. So I would anticipate over the next month or so that you would see similar occurrences within the House of Assembly. But we're working with all three parties here, as you know, so with limited numbers. And tomorrow, for the first time, we will have a question period.
Thanks. And wondering if there's been any more thought given to, when a budget can be expected this year?
Well, right now, I think when you look at the budgeting process, given all the uncertainties that we've had to deal with this pandemic, it would be very difficult to put in place a budget that would have any degree of certainty in terms of forecasting and predictions. But we know now that as we work with all our opposition parties, and we learn from the experiences that we've seen in other provinces. I speak to premiers, on a weekly basis and sometimes twice a week, and the budgets that they would have put in place before this pandemic is not really worth the paper that, is written on. And so right now it's very difficult with so many variabilities, and added to that, of course, is the collapse of the oil prices and unemployment. People that are now unemployed. So it would be very difficult to put in place any budget that would have any meaningful, degree of forecasting. So as we work our way through this, work with the Department of Finance and other departments, And right now, we have an interim supply that will keep us going till September. So it's important that we have that supply bill in place, and we can actually have the borrowing measures in place as well. So all the components of paying for the services are in place with that supply bill, but putting a budget in place right now would be very difficult.
Thank you. And wondering too about the travel restrictions of entering the province. Do you have a sense of kind of at what point along these alert levels those rules might change?
It will depend very much on what the situation is. So what our own situation is, if we get a lot of imported cases, or if we're in a similar situation to where we are now. But it'll also depend on what's happening elsewhere in the country and elsewhere around the world. So if we're still seeing large outbreaks in elsewhere in the country, then, obviously we're going to be more cautious about lifting any such ban. But it will very much depend on what we see going forward.
Our next questions are from Elizabeth Witt of All Newfoundland and Labrador. Please go ahead.
Businesses given the okay to reopen on May 11th, what are the guidelines for staff who might not feel it's safe for them to go back to work? For instance, could they lose out on subsidies?
You're talking about the subsidy from the federal programs, I'm guessing. So right now, I think it's been very clear that all the messaging would be that if people are not safe to go to work, well, they should not go to work. So right now, they would work with their local businesses. There have been decisions that have been made at the various alert levels along the way to make sure that the provision for things like childcare would have been provided, recognizing this is an essential component for people, giving them, the ability to go back to work. So right now, if people are not comfortable in going to work, indeed, that's, it's not something that they should do, but work with your employers. And there are those federal programs that are in place right now for people that have lost wages because of COVID-19.
All right. And I guess I was wondering, has there been any changes or updates regarding our supply of PPE?
So right now, the supply of PPE has been consistent. It's always been challenged, as you know. So the big focus right now on the calls that I would have with the Prime Minister and the other premiers is to work towards a level where we could have more of it supplied nationally within our own provinces and in other parts of Canada, as an example. So I think if there's a lesson as we debrief coming out of COVID-19, we will recognize that PPE, we need to be able to supply as much as that within Canadian jurisdictions. We've been very fortunate to be able to work with, some groups within Newfoundland and Labrador to be able to help with the supply, but also with the group at Health and Community Services, some dedicated people there that are monitoring this on a daily basis. And there are shipments that are coming in, as the minister said quite often, we very rarely get or ever get, the amount that we've ordered, but, we've not been out of stock of the essential items that's required for PPE.
Excellent. And this is a question about CHANNAL. I was wondering if Paula could go into some detail about how that line of work has changed and expanded over the pandemic.
Thank you for the question. So we've looked at changing our services. Obviously, we've taken all of our in-person services and reduced them to virtual services when possible. So for example, right now our groups, in-person groups have been suspended. However, we do run a virtual group using the platform Zoom. And so that really gives us the opportunity to still engage, to still have that visual contact with people and still be able to have the conversations that people need to have. Our warm line, how we manipulate the program and deliver the service, has changed as well. So back to the safety of staff, we have created a situation where our staff are able to deliver that service from their own homes to or at least reduce the risk for them going out into the public and into the offices. And within that, we have again changed the format somewhat. And so if you are a user of our services from the past, you may see a little bit of a different service delivery in that our staff are now returning calls as opposed to taking calls. We do have some ability to take a call and respond immediately. However, because of some of the technical pieces that we weren't able to align, we actually have more calls coming in that are responded to through our message manager. So anyone who is using the service, we are highly encouraging them to leave a message. Just a telephone number is sufficient. We highly are focused on confidentiality and privacy. The information is not retained in any database or any platform other than to take the message and return the call. And so we really encourage that use of that service. When we look across the province, we have offices in about 6 different regions now in our province. And while our staff are still available and still active, we are really reducing that in-person service. Our warm line has actually increased its hours. We open at 9 a.m. and we continue until 12 midnight. And we are taking those calls and returning those calls and have actually aligned more of our staff to take those calls. Typically, we would have 2 to 3 people assigned to such a task. Now, sometimes we have up to 5 people assigned to said task. And so, yeah, that's where we are in terms of the services, and really just very active on social media in terms of providing that additional support for people, that additional motivation for people, and engaging people in that direct messaging and texting platform. That's where we are right now. Just as an additional piece, on Friday, we will actually be, for the first time, hosting one of our traditional groups, our Freestyle Friday, which is a music group. And so we're going to attempt to do that virtually as well this Friday in honor of Mental Health Week.
Thank you.
Our next questions are from Andrew Robinson of the Telegram. Please go ahead.
A woman today whose family owns a RV that's kept at a private campground. She was suggesting that people like herself and her family are already used to physical distancing, have been for several weeks, and feels that they can be trusted to continue doing so if they were permitted to go back to their campsite environment. Just wondering what's your response to this sort of these sorts of feelings?
So I think we have to consider the whole situation, and there's more than just the social distancing. In some areas, there's sharing of facilities, and we have to be careful about that. Then there's always with camping, and I certainly don't want to speak to any one particular person or to any family in particular, but when people go camping, there are other festivities that happen along with camping, and certainly impairment of judgment can happen. And so those are all concerns that we have to consider when we're thinking about activities. Is we need to be certain that we're approaching it with the best public health in mind.
I know too. There's different, precautions in play for how campgrounds could reopen, initially allowing them to operate as day sites, and at another alert level, then allow them to operate for overnight stays. Why were these, why were these measures put in place?
So the difference is most often just because of use of communal facilities and that sort of thing. So day use, it appeared to be, people would come, they would leave at the end of the day. They may be more able to practice physical distancing and that sort of thing. So there was some differentiation there between overnight and daytime usage.
We heard from someone involved with a retirement residence in the metro area. That mostly residents in the age range of the 80 plus, 70 odd residents in the building. It's a fairly densely populated apartment space, and they're concerned about with the bubble opening, having twice as many people and more, coming into the apartment building and creating potential challenges. Is it permissible for places like this to ask their residents to instead go off-site to visit people in their bubble, and then in some cases allow them to accept visitors on-site?
I can't speak to the legality of that particular question. Certainly, we make recommendations for how people expanding your bubble and to certainly have frank conversations about how to keep people safe, and those would all have to be considerations with regard to expanding the bubble. But going off site may be a more reasonable thing to do, but again, it depends on the individual person and what the situation is. And if these are apartments and people are physically distancing and practicing good personal hygiene, washing your hands well, doing all those things that we've been recommending, I would think that they would be able to decrease the risk. Obviously, staying away from communal areas would be important, but if they're going to somebody's apartment and visiting their apartment and leaving right after, then that significantly reduces the risk. But again, just because you can increase your bubble doesn't mean you have to, and we certainly would want people to think about who they're combining with very carefully to make sure that they're not increasing the risk to somebody who may be in a more vulnerable group of people.
Thank you.
Thank you very much for tuning in. The time for questions has ended. We invite you to join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.